In studies by my research team, funded by the U.S. government's National Institutes of Health and the Diabetes Action Research and Education Foundation, along with the work of other researchers, we have completely redesigned the dietary approach to diabetes. If your experience with diabetes has been one of gradually escalating medication doses, ever-increasing weight, and increasing worry about the risk of complications, you will learn how to reverse those trends. We will focus on changes in your menu, not on drugs. Yes, medications often have their role, and I will give you details on how they work so you can understand the ones you or your loved ones may be using now. But I would much rather help you scale back on drugs or eliminate them entirely. Doing that means rethinking the foods that you eat. Let me emphasize that you will not need to cut calories, limit carbohydrates, or stick to small portions. In fact, you can eat until you are full. If you get hungry between meals, you are free to eat more. What we will zero in on is the type of food you eat. That has emerged as the critical factor, as you will soon see. A new idea. My father, Donald M. Barnard, M.D., spent his entire life treating diabetes. He grew up on a family farm in the Midwest, but soon realized that the cattle business was not for him. He decided to go to medical school, and after training at Boston's famed Joslin Clinic, he began work at a busy community hospital. He became known as the diabetes expert for the surrounding area. But he and the other doctors and their patients often found diabetes puzzling and frustrating. He recounted a telling comment made by the clinic's founder, Elliot P. Joslin, M.D., about diabetes research. "Gentlemen, we don't need a big research grant. What we need is a new idea." Dr. Joslin made that observation back in the 1950s, and the need has only grown more urgent as the incidence of the disease has exploded. Worldwide, about 200 million people are living with diabetes. Until now, most have found the condition to be at best an exercise in drudgery, with daily blood tests and medications that promise only to slow the disease's inevitable damage. A patient's life becomes a waiting game, with one complication arising after another, from nerve symptoms to visual changes and heart and kidney problems. Now, at last, we're on the cusp of real change. I'm talking not just about a bold new idea, but about an entirely new approach to diabetes that has been tested and proven. In a series of research studies conducted with Georgetown University and George Washington University in Washington, D.C., our research team has proven that many people with diabetes can think beyond delaying inevitable decline and improve their health dramatically. They can cut their blood sugar, increase insulin sensitivity, and reduce or eliminate medications, and they can do this with a simple set of diet changes. Unlike with medication treatments, the side effects of the menu change are good ones: weight loss, lower cholesterol levels, lower blood pressure, and increased energy. From the beginning, our studies aimed higher and took a more aggressive approach to diabetes than clinicians had in the past. The first study was small, just 13 patients, and it tested a program that relied entirely on changes in diet. There was no new drug, no magical supplement, not even an exercise program, but the results were amazing. 2/3 of patients improved so much that they were able to reduce or eliminate their medications within 12 weeks. The study was published in Preventive Medicine in 1999. Then, in a second study, this one involving 59 patients with varying degrees of blood sugar control, some healthy, others pre-diabetic or diabetic, we studied why diet change works. It became clear that the diet shift actually caused a fundamental change in the body itself. In 14 weeks, the diet led to a 24% improvement in insulin sensitivity, that is, the body's ability to respond to insulin, the sugar-storing hormone that is dysfunctional in diabetes. Participants whose blood sugar levels were in the abnormal range saw them promptly return to where they belonged. While exercise could increase the benefits even further, diet changes alone were powerful enough to boost insulin sensitivity and bring blood sugar under better control. The results were presented at the American Diabetes Association scientific meeting in 2004 and were published in the American Journal of Medicine in 2005.